Oh no, they're still dirty. You wash your hands. Still dirty. Two more times. Two more times. One more time. One more time. I want all the germs gone. Oh, that's pretty good. Oh no, one more time. Okay, that's better. Look, your hands are still wet. Two more towels. Nice.
Oh, I need to brush my hair.
4 times. 4 times. Brush. It's not brushed good enough. Keep brushing. Oh, your ears need to be cut, but keep brushing. It's a little too fluffy. Put some water on it or something. You look raggedy. Okay, water and brush for 2 more times. Maybe you should put it up. Yes, that's more like it. Perfect.
Come in.
Hey, you ready to go?
Yeah, I'm almost ready. I just have to get this straight.
We gotta hurry up. We were supposed to leave like 2 minutes ago.
It's not straight though.
It's fine. I mean, it looks good to me. Are you ready?
No, your shirt is very wrinkled. I'm gonna think you're not clean.
I have to go change my shirt. It's wrinkled. And I have holes in my jeans.
What's wrong with your shirt and your jeans? You look fine.
It's wrinkled. And you see it's got a stain. I gotta go change. I'll be right back.
Okay, hurry. We really gotta go.
Okay. Oh, I think I'm ready now. There's no wrinkles in my shirt and there's no holes in my jeans.
Okay.
Yes, you look great. No one's gonna think you're not dirty.
Okay, you ready to go?
Yeah.
Did you check to make sure the stove was off?
No, I didn't. I had to go check the stove real quick. I'll be right back.
Okay.
Okay, I just have to make sure it's off just real fast. Oh, it looks like it's on.
No, check it again.
All these are off. The light's on.
Check it again.
They're all off.
What are you
You're
doing?
gonna burn the house down.
I have to make sure it's all off. It's not off.
Your parents
They
might
are
blow
off.
up.
I have to check it 4 more times.
One more time. One more time.
But
Check it.
hey, they're off. Why are you checking it so many times?
I just have to make sure they're off. Like, how do you know it's off?
Because they say
The light is still on. Make sure that they are off.
Okay. The light's off.
It's off.
Oh,
Okay.
See,
I checked it
look,
4 times.
Look, see, they say they're off.
Okay.
Can we go now? Because we
Yes,
really got to
I'm
go.
ready.
We got to go to lunch.
Okay. We can go.
Oh, you forgot to check the light switch.
Oh, I have to check the light. I'll be ready in just a minute. I have to make sure they're off.
Make sure
Are
they're
they off?
all the way off.
They're off. See?
Okay. Yes.
2 more times. Check it again.
Okay. They're off.
Dude, we got to go. The
One more
lights are off.
time.
The stove is off.
I have to check
Everything
it
is
one more
off.
time. Okay.
Okay.
They're off.
They're off.
I'm ready
Okay,
now.
Are we ready now?
Yeah.
Okay, let's go. So, how's your paper going for Miss Bell's class?
I haven't
not
finished
done
it yet. I just,
It's not perfect.
it's not
It has to
perfect,
be
so I have to
neat.
get it done.
Oh, okay. Well, you know it's due tomorrow, right?
Yeah, I just have to
It's
make sure
very
it's still
unorganized.
perfect. Make sure it's all organized.
Oh, okay. Do you need any help working on it or anything?
No, I don't think so. I just have to make sure it's really perfect.
Oh.
Nothing's wrong with it.
Okay. Well, I mean, I can help you if you need it.
Your
It's due
necklace
tomorrow.
is backwards. Fix it. Turn it the other way. No, the other way.
Is your necklace messed up?
Yeah, it's crooked. It has to be straight.
Okay. That looks good to me.
Okay. I just gotta make sure my hands are clean
Your
real
hands
quick.
are dirty. You're touching the table.
Okay.
Put some more on.
Oh, that's a lot of hand sanitizer.
My hands ain't clean. You can see they're still dirty.
Stop touching stuff.
I feel like that might be enough. I mean, you've done it 4 times.
You're
Okay.
clean.
They're clean now. I can eat now.
Oh, okay. Man, I really should have got one of those cookies. Do you mind if I have a bite?
No,
No,
she
you
just
can't
contaminated
touch
your
my
food.
stuff. My food is
You
dirty
have
now.
germs everywhere.
I can't eat.
Oh, I'm sorry. We shared food before. I didn't think it would be a big deal.
But you made it dirty now. I can't eat that food. My
Oh,
plate is dirty.
do you want me to go get you another one?
No, I'm not hungry anymore.
Oh, I'm sorry.
It's all right. I think my dad is texting me. I have to go home.
Okay, well, let me take you back home, okay?
Okay.
Wash your hands. Put some more hand sanitizer on.
Let me wash my hands first.
Okay. Ready?
Yeah.
Done.
Hey, it's me, Mackenzie. I left my key.
Oh,
Hey, Dad.
I'm Mackenzie.
I'm back home from lunch.
Okay, I'll see you later.
Okay,
I'll text you
bye.
tonight.
Thank you for dropping her off. I appreciate that.
Oh, yeah, no problem. Can I talk to you for a second?
Yeah, I'll be right back, okay?
Okay.
Hey, so I noticed something really weird going on with her. She's like really acting strange today. When I
Like
come
what?
whenever I come in like earlier, she had to change her clothes because they were wrinkled and she had holes in her jeans, and she
Okay.
just acted like really crazy. She was straightening everything. When we was at lunch, she freaked out on me because I touched her cookie. She's been constantly washing her hands and using hand sanitizer like 1,000 times. I'm just really worried about her. We have an assignment due tomorrow, and she said she hasn't finished it.
Okay. She's never really had any problems in the past, but her mother was always very, picky about how she did things. So maybe I'll have a talk with her and see what's up. I definitely appreciate that. So.
Okay, yeah, because I'm just really worried about her. I don't want her to fail this paper tomorrow. So if you would just let me know, okay?
Of course.
All right.
Thank you very much.
All right.
Hey,
Hey, Dad.
how you doing?
Good. How are you?
I'm doing all right.
Straighten the books up. They look.
Are you okay?
Yeah, I just have to make sure these are straightened.
Okay. Your friend was telling me that you've been acting a little bit weird lately.
Yeah, everything just has to be organized.
Spread 'em out.
It's not organized.
Have you been feeling okay?
Yeah, I feel okay.
No, stack them back up.
Has anything been bothering you?
I don't know. I just have to like organize everything now. Like
Hmm.
it's just everything is a mess.
Okay, she's been telling me that you haven't been completing your assignments. Is there something going on, or?
Well, yeah, I just have to make sure it's perfect. So I don't want to submit it if it's not perfect. I don't want to submit it and then have a bad grade because it's not perfect.
Mm-hmm. Okay. Well, I'm always here to talk to you, right?
Okay.
Do what?
I'm always here to talk to you, right?
Yeah.
Okay. Well, maybe we should go see the doctor. We haven't been to the doctor in a while, so.
Okay.
Okay. Let's go.
I have to make sure my seatbelt is buckled. I have to do it 4 times.
Are you okay?
No, I just have to make sure it's buckled. It has to do 4 times, okay?
I think it's buckled.
It has to be on 74. 4 is a good number.
Why 74?
4 is just my lucky number, okay?
Okay, I guess that's fine. Okay, so we're going to make sure to tell the doctor everything he needs to know about what's going on, okay?
Okay.
So that we can be able to help you.
Alright.
Are you comfortable? Are you okay?
No, I just have to move my seat. I have to do it 4 times. It has to be even.
Okay. Okay. And make sure, I actually got a call from your teacher today, about making sure that you do your assignments. So we need to make sure that you're finishing them, okay?
Okay. I've been trying to work on them. It's just, I have to make sure they're perfect, so it takes me a while.
Okay. Well, whenever we get to the doctors, okay, just make sure to tell them everything that
Okay.
they need to know. Okay.
Okay.
Okay. We're pulling in now. Okay.
Okay.
So we're gonna tell the doctor about your assignments and everything that's been going on. Okay. So that way he can be able to help you.
Okay.
Just gonna pull in here. Okay. Let's go inside. Okay.
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 Come in.
All right.
Hey, how are you guys doing today?
Good. How are you?
Good. So, what's been going on? What brings you guys in today?
So I brought my daughter in today because she's been acting a little bit strange, not finishing her homework assignments, she's been like doing some strange things where she'll make sure everything's perfect when she's doing stuff, and it's just not something that she usually does, she's acting just very strange for, my daughter, so.
Okay. How long has this been going on for?
Her friend was the one that actually told me about it until I noticed, if I had to say it, probably about a week or two, more or less, so.
Okay. Have you had any problems where you tend to wash your hands a lot, or you're scared of like germs or anything like that?
Yeah, I have to wash my hands like at least 4 times just to make sure they're clean.
4 times?
Yeah.
Is it always 4 times?
Yes, 4 times.
Okay. How about whenever you're at home? Does everything have to be symmetrical and exactly in order, or it bugs you?
Yes, it has to be all in order. Everything has to be in order.
So if something falls or it's out of place, you have to fix it? Okay. Do you like have the thought that you have to fix it, or?
Yeah, like, I don't know, it's just like this voice in my head and it tells me I have to fix it.
Has to fix it, okay. How about repeatedly checking things? Do you check things often even though you've already checked them?
Yeah, like I have to check a light to make sure it's off. Like I have to check it like 4 times.
Yeah, her friend earlier said that it took her maybe 45 minutes to an hour just to be ready because she kept going back to check, the light switch and everything. So,
okay.
and changing her clothes even though there was something wrong with them, so.
Okay. Why did you feel you had to change your clothes?
They just had wrinkles in them and like my jeans had holes. So I had to make sure they were all like clean, not wrinkled.
Okay. What do you think would happen if you wore a wrinkled shirt?
I would just
holes in your jeans?
I would just look dirty. Like I just want to be clean and it has to be even.
Okay. How about performing actions and tasks like a certain number of times? I know you said you normally do things 4 times. Is that for everything you do?
Yeah, most things.
Okay. And does the thought it make like you can't leave or anything without having to do it 4 times?
Yeah, just the voice doesn't go away until I do it 4 times.
Okay. All right. So I'm gonna go ahead and I'm gonna take a listen to you real quick. Already gonna walk back here and wash my hands real quick. All right, and just put on my gloves.
Do you think something's wrong with her?
I'm gonna let the doctor know some things that she has going on. It definitely sounds a little bit out of the ordinary, but we will definitely let the doctor know, and he'll come in and talk to you guys and see where we need to go from here. Has she been okay otherwise? You haven't been experiencing any headaches, any like sickness feelings? It's just been the thoughts in your head, like you have to do things?
Yeah.
Okay. All right, I'm just gonna take a quick listen to you real quick.
Wait, hold up. Is that clean?
Yeah, it's clean. I cleaned it.
Sure?
Yeah, I cleaned it right before I come in here.
You cleaned it 4 times?
I didn't clean it 4 times. I cleaned it between every patient, though. I can assure you that it's clean.
It has to be clean. I had to see you clean it 4 times.
4 times?
Yes.
Okay.
4 times.
All right. So I'll go back and I'll clean this for you, and
Okay.
we'll go ahead and we'll get the doctor in here. Okay.
Okay. Thank you.
You're welcome.
Come in.
Hey, Dr. Trey.
Hi, how are you?
Good. How are you today?
Doing alright.
Good. So I have a patient in room 1. Her name is Mackenzie Bachnia. She's
Okay.
here with her dad. She's a 19-year-old female. She's presenting with some anxiety. Her dad brought her in because he was concerned. He
Okay.
said that he noticed some strange behavior going on for the past week or two. She said she seems to be washing her hands a lot, to the point where they're kind of starting to get red and irritated. She's obsessed with the number 4, so she has to do everything 4 times.
Okay.
She has to brush her hair 4 times, brush her teeth
Okay.
4 times, wash her hands 4 times. She's also been not completing assignments at home. She says that she has to wait until things are perfect in order to submit them, and that way she's not submitting them on time.
Okay.
So her grades have been slipping. She has to make sure that everything is clean, again, 4 times. She wouldn't let me listen to her part without cleaning my stethoscope 4 times.
Oh, really?
Yeah, so, she also has to make sure that everything is in order. Her dad says if she knocks something over, she has to fix it and make sure that it's completely in order before she's able to leave it alone.
Okay.
She said that there's a voice in her head that says that she has to make sure that everything is perfect and just the way that she wants it and clean.
Okay.
So he's concerned, and she just seems a little fidgety in there. She was fidgeting with her pants, making sure there's no wrinkles in her shirt. Just kind of, you can tell she's a little bit uneasy.
Got you. Okay. So based off of everything you're telling me, it does kind of sound like it may be OCD, which can range from mild to severe. Now, off the things you told me, you know, with the contamination, with the germs, the superstitions, wanting to do things a certain amount of times, and also the perfectionism, you know, wanting to make sure everything is how she wants it. I would say that it's probably affecting her, you know, daily life, especially, you know, if her father noticed as well. So, what I would like to do is to get an OCI-R, which is a self-rating scale used to assess the severity and type of symptoms for OCD. Now, with OCD, rarely do they need to be hospitalized unless if any suicidal tendencies occur, such as cutting themselves. Do you notice anything that might indicate any kind of self-harm or maybe something like that?
No, whenever I was doing her assessment, I looked at her arms and legs, and I didn't see any sign of self-mutilation. I also asked her, and she denies.
Okay, perfect. Okay. All right, so first, for OCD, the type of medication that we like to prescribe is an SSRI, such as fluoxetine or Prozac, or sertraline or Zoloft. So what I think I'm gonna do for her, I'll go in and assess her myself as well, but I think what we're gonna do is probably 20 milligrams of Prozac, start on that and see if that helps any. We might also need to do a type of therapy in correlation with this, so there's several different types. 2 of the main ones are exposure and response prevention, and also flooding. For her type of scenario, I think that the exposure and response prevention will be a lot more beneficial for her. And like I said, I'm gonna go in there, see how she is myself, and you know, kind of judge it off of that. But and make sure I'll go in there and I'll talk to them as well. Whenever you're educating them, ask them if they have any questions. Make sure you emphasize that there's really no cure. However, with the medications and the therapies, you know, maintaining that regimen, you know, it can be managed, and you know, she can still live a relatively, you know, really normal life. So, and I think that's about it. So, I will go see her. I appreciate your assessment and everything, and you just tell them I'll be right in there. So,
Okay, I'll let her know.
thank you.
Come in.
Hey again. So I just saw that Dr. Trey just come out of here. I know he talked to you guys about your diagnosis of the OCD. Along with the diagnosis of OCD, I also have a nursing diagnosis for you. I see that you're struggling with some anxiety. So we've definitely got to get that under control. So your anxiety, it's probably related to your fear of the germs. And that's, you know, we have evidence of that by you washing your hands repeatedly. You're obsessed with things being very clean and stuff. So some of the medication that he prescribed for you, it's going to help with that, help get that anxiety under control, so that way you hopefully won't have those compulsions as much, or hopefully not anymore. So it'll definitely help you get back to a good level of functioning. I wanted to see if you guys had any more questions for me, and see if I needed to explain anything a little bit better or anything.
So he, like you said just now, you know, he said that the doctor said that she had OCD. Can you kind of explain that a little bit? Because me myself, I have obesity. So I was just wondering if that's like related or,
Okay, yeah, so it's not related. So with OCD, it's called obsessive compulsion disorder. So the person experiencing that, they normally have obsessions, which is the obsession part of that. That's thoughts, impulses, images that come into their mind repeatedly. So they can't be dismissed from that person's mind. It's very hard to get rid of that once they start thinking about it or have those obsessions. It can cause some pretty severe anxiety, which is what we're seeing in this case. She's very anxious and stuff like that. So the compulsions, they're ritualistic behaviors that the individual feels driven to perform and attempt to reduce that anxiety level. So the severe anxiety they have, they want to reduce that level by performing these things, such as switching on the light switch on and off 4 times, checking the stove 5 times, things like that. The relief is temporary when they do these things, when they do those acts, but it must be done again and again in order to feel that relief, which is why they do it so many times. Okay, so the females are slightly more effective than the males. Onset after 35 years old is kind of rare, so we do normally see it around this age here. It does have a strong genetic link, so if there's anybody in the family that has OCD, it can occur a little bit more frequently.
Gotcha.
And it usually occurs with anxiety disorders.
Okay.
So they can have symptoms that range from mild to severe. They can have issues with sexuality, violence, contamination, illness, and death. The compulsions make them feel distress, humiliation, and shame, so they get very embarrassed when they have to do these things.
Okay.
It can interfere with relationships and social activities and even abilities to perform activities of daily living. So it can make it hard to do normal things like getting dressed or leaving the house, brushing her hair, things like that. So, did you have any questions about the medication or anything?
Yeah, what was that called? Like pros something?
Yeah, the medication that the doctor said he wants to put you on is called fluoxetine, which is also called Prozac. So it's from a class called SSRIs, which is a selective serotonin reuptake inhibitor. It helps with your anxiety. So some side effects that can come with this medication is sweating, itching, diarrhea. It can cause tremors, drowsiness, headache. It can also cause a little bit of trouble sleeping at night. So if you have any of those symptoms, just let us know and we can see if we need to switch you to something else. I know all those symptoms sound scary, but hopefully this medication will help you get to feel better with as little side effects as possible.
And how long did you say until her symptoms start to kind of go away and she starts to feel better?
Okay, so this medication normally takes 4 to 6 weeks for you to really be able to start seeing signs of improvement. It can be seen maybe a little bit before then, but it's normally 4 to 6 weeks until it's fully in your system and you're able to start feeling like it's actually working for you.
Gotcha.
And with this medication, you want to make sure that if you have any ideas of suicide or worsening or increasing anxiety, you want to let us know so that way we can stop that medication and we can get you on something else. So definitely let us know immediately if that happens.
Okay. And he also said something about some kind of therapy that he wants her to do. Exposure therapy, was it? Something like that?
Yeah, so there's a therapy that we can use. It's called exposure and response prevention therapy. It's the first line cognitive behavioral intervention for OCD. So with this therapy, you are exposed to stimulus that triggers the specific OCD symptoms. So for an example, she has the fear of contamination. So we would have her touch a doorknob or touch a faucet without washing her hands immediately. So you expose them to those things so that way eventually as they're exposed to those things and in real life out in the real world, hopefully they won't cause such a anxiety response as she gets now when those things happen.
Okay.
So it's pretty much just, there's also a exposure therapy called flooding, which we don't think would be a very good fit for her. You use that. It's an exposure to a large amount of stimulus. It can be very overwhelming for some people. It's an effort to extinguish that response as well. But in her case, we think that the exposure and response prevention.
Yeah, that one definitely sounds a lot better. Is there any way that I can help her myself, or?
Yeah, so we definitely encourage the families to be part of the therapy. Families, I know you guys get very disrupted by the symptoms of OCD. So we normally recommend that the families of patients with OCD come in for an evaluation. It's a very essential part of the care for OCD.
Okay.
And it's very important for you to have an active role as long as the patient is okay with that. I know she's 19, so as long as she's okay with that, we definitely want you to be involved. Normally we see better results when families are supportive and you attend the therapies, and you can even have her make sure that she's taking her medications appropriately and things like that.
Okay.
There's also some community resources available for you as well. There's some support groups that you can attend that you're with people who have the same diagnosis as you, so they have OCD, so you can talk about their experiences, share your experiences, and that way you can help connect. It can help you connect with people and you not feel so alone and things like that. So you know you're not the only one that experiences these things.
So what about her grades? I know that she's gonna have a hard time. Is there any way we can get any kind of help with that, with the school or something like that, or?
You can probably go see your guidance counselor at your school. A lot of times they're very understanding and they have disability services, even though it's not, it's technically a disability, but you can go see them and they can have special accommodations for you. Like they could possibly extend your deadline so that way they can allow you more time to finish your assignments until you get on appropriate treatment and things like that. So that way you're not failing in school due to your illness.
Okay, is there anything else that we need to know, or?
No, I don't have anything else for you guys. Do you have any more questions for me?
I don't.
No, just tell that doctor that he was very handsome for me.
Okay, I'll definitely let him know.
Okay,
I'll give him your number if you'd like.
thank you very much.
Okay. All right, we'll see you guys back for a follow-up visit in about 4 to 6 weeks, and we'll evaluate how that medication is doing, and we'll go from there. All right.
Thank you.
Thank you. Give me just a minute. I just gotta grab my watch, okay?
Okay.
All right. I'm ready to go.
Two more times.
For 35 years,
Yeah, I can cut that part out. So just,
Okay.
yeah, you got it. Just, helping her with her symptoms that she has. That's okay.
Yeah. No holy jeans
I was
and no
about to say-
wrinkles in my shirt.
No holy shirt.
I gotta wait till you finish talking. Okay.
Let's go inside, okay?
Okay.
Okay, you ready?
Yeah, I think so. You used to say it. Your lyrics.